The hidden warning. Your feet are sending about your liver. Could your feet be screaming a warning you've been ignoring? What if the solution to preventing liver failure was literally right beneath you? When was the last time you really looked at your feet? These aren't just questions. They're lifelines. Because right now, while you're reading this, your liver might be struggling, silently failing, and your feet could be the very first witnesses. Every single day, thousands of Americans walk around completely unaware that their organs are in crisis. They ignore the subtle changes, the tiny signals, the whispers from their own bodies. But here's what medical research has proven beyond any shadow of doubt. Your feet don't lie. They can't hide what's happening inside you. Science shows that liver disease affects approximately 30 million Americans. That's nearly 1 in 10 people. Many have absolutely no idea until it's almost too late. The damage has already been done. But what if you could catch it early? What if your feet were trying to tell you something right this very moment? This isn't about fear. It's about awareness. It's about taking control of your health before the point of no return. Let's begin. 1. Swelling in your feet and ankles that won't quit. You remove your shoes at the end of the day. You notice something different. Your ankles look puffy, swollen. When liver function becomes compromised, conditions like peripheral edema can develop, causing excess fluid and toxins to accumulate in the lower extremities. Here's why this happens. Your healthy liver produces albumin, a critical protein that maintains fluid balance within blood vessels. When liver function declines, albumin production drops. Fluid leaks out. It pools in your legs, your feet, your ankles. Try this simple test right now. Press your thumb firmly into your ankle. Hold it there for 5 seconds. Release. Does a dent remain? Does it take time to disappear? This is called pitting edema. It's a red flag. Not everyone with swollen feet has liver disease. Heart conditions can cause it. Kidney problems too. Standing all day creates swelling. But if your swelling is new, progressively worsening, and appears alongside other symptoms, that's when you need medical evaluation. In advanced stages of liver conditions like cirrhosis, foot and ankle swelling becomes a notable manifestation. Don't ignore what your body is showing you. 2. Pale, whitish nails with only a thin pink band at the tip. Look at your fingernails right now. Then check your toenails. Do they appear unusually pale? Almost white? With just a narrow strip of pink at the very end? This distinctive pattern has a medical name. Terry's nails, which have been documented in up to 80% of individuals with cirrhosis. It was first described in 1954 by physician Richard Terry. He noticed this peculiar nail change in patients with advanced liver scarring. The mechanism behind this involves changes in the nail bed itself. The condition results from alterations in nail bed vascularization and increased connective tissue beneath the nail. Does everyone with pale nails have liver disease? Absolutely not. Terry's nails can also appear in people with kidney failure, congestive heart failure, diabetes, and sometimes just with normal aging. But the frequency in liver disease is striking. If you notice this change, especially combined with other signs, document it. Take photographs. Show your healthcare provider at your next appointment. Early detection changes everything. 3. Tiny red spots with spider-like legs radiating outward. These aren't regular freckles. They're not simple broken blood vessels. Spider angiomas are characterized by a central red dot with radiating capillaries that resemble spider legs. They typically appear on the face, neck, chest, and upper torso. But they can also show up on your arms and sometimes your legs. Here's a fascinating test you can perform yourself. Press directly on the center of the red spot. It disappears completely. Release the pressure. Watch it refill from the center outward. This blanching and refilling pattern is diagnostic. No other type of skin marking behaves this way. Why do these form? When the liver cannot properly metabolize circulating estrogens, particularly estrone, these hormones accumulate in the bloodstream. Elevated estrogen levels cause the sphincteric muscle surrounding cutaneous arterioles to fail, leading to dilation. The result is these distinctive spider-like formations. Having one or two spider angiomas doesn't automatically mean liver disease. They appear in approximately 10 to 15% of healthy adults and young children. Pregnant women often develop them due to naturally elevated estrogen. Women taking hormonal contraception may see them too. But here's the crucial threshold. Having more than 3 spider angiomas is likely abnormal and may signal liver disease. Multiple spider angiomas demonstrate 95% specificity for chronic liver disease. That's remarkably high. If you count 4, 5, 6, or more of these markings, especially if they're appearing in new locations, that warrants immediate medical consultation. Take clear photos with your smartphone. Document when you first notice them. Note if they're increasing in number. This information helps your doctor tremendously. 4. Persistent itching on the soles of your feet, especially at night. This isn't your typical itch. It's different from dry skin. There's no visible rash, no redness, no bumps or hives, just an unbearable, deep, internal itching sensation. It intensifies when you lie down at night. It disrupts your sleep. You scratch and scratch, but nothing helps. When the liver cannot effectively process and deliver bile, bile acids begin accumulating in the bloodstream and depositing in the skin. These bile salts irritate nerve endings. They create a type of pruritus that feels like it's coming from beneath the surface. This symptom can appear months or even years before other obvious liver disease signs. It's frustrating because it's invisible to others. People might think you're imagining it. But you're not. Your body is communicating something profound. If you're experiencing this kind of relentless itching without any apparent cause, particularly if it affects your feet and worsens at night, discuss it with your healthcare provider. Pruritus represents one of the specific symptoms that can occur when bile flow becomes impaired. Blood tests can check your liver enzyme levels and bile acid concentrations. 5. Dry, cracked heels that never seem to heal. You moisturize regularly. You use thick creams. You try every product available. But your heels remain deeply cracked and painfully dry. Most people with cracked heels simply have cosmetic concerns. Climate plays a role. Walking barefoot contributes. Improper footwear makes it worse. These are the common benign explanations. But sometimes there's a deeper reason. When the liver cannot properly process bile, the absorption of fat-soluble vitamins including A, D, and E becomes impaired. These vitamins are essential for skin health. Vitamin A supports skin cell regeneration. Vitamin D reduces inflammation. Vitamin E protects against oxidative damage. When your body can't absorb them efficiently, your skin suffers. It becomes excessively dry. It loses elasticity. It cracks more easily. This is particularly noticeable on pressure points like heels. How can you tell if your cracked heels might indicate something more serious? Look for the pattern. If they're accompanied by other symptoms from this discussion, pay closer attention. If regular intensive moisturizing with urea-based creams doesn't improve them over several weeks, that's noteworthy. If you're also experiencing itching, swelling, or changes in your urine or stool color, these pieces fit together. Start with good foot care basics. Use creams containing 10 to 20% urea. Wear cotton socks. Choose supportive, well-fitting shoes. But if the problem persists, despite proper care, and especially if combined with other warning signs, seek medical evaluation. 6. Frequent nighttime leg cramps that wake you up. 3 in the morning. Sudden, excruciating pain shoots through your calf. The muscle contracts violently. You leap out of bed trying to stretch it out. This happens multiple times each week. Leg cramps have numerous causes. Dehydration is common. Electrolyte imbalances occur. Overexercising triggers them. Remaining stationary for extended periods contributes. These are the usual suspects. But in liver disease, particularly as it progresses, the body's fluid and electrolyte balance becomes disrupted. Potassium levels fluctuate. Magnesium becomes depleted. Sodium concentrations shift. Advanced liver conditions can cause significant electrolyte disturbances and changes in body fluid volume. All of these factors increase cramping frequency and intensity. If you're experiencing leg cramps several times weekly without obvious explanation, especially combined with ankle swelling or any other symptoms we've discussed, this pattern deserves investigation. Keep a cramp diary. Note the frequency. Record the time they occur. Document what you were doing beforehand. This information helps your doctor determine if further testing is warranted. 7. Unusually thin, shiny skin with prominent veins on your feet. This is the most subtle sign of all. The most nonspecific, the easiest to overlook or dismiss. You might notice the skin on the top of your feet appears different, thinner somehow, more translucent. Veins that weren't visible before now show clearly. The skin has an unusual shine or pallor. This can result from many factors. Natural body composition variations, loss of subcutaneous fat as we age, varicose vein conditions, anemia. In isolation, this sign means very little. It's not a reliable marker for liver disease by itself. But remember what we've emphasized throughout this discussion. It's about patterns. It's about combinations. When thin, shiny skin with visible veins appears alongside symptoms like edema, dark urine, pale stool, abdominal bloating, or spider angiomas, the clinical picture changes. Then it becomes part of a larger constellation requiring comprehensive medical evaluation. Never diagnose yourself based on one single sign. Look at the whole picture your body is painting. Additional symptoms that demand immediate attention. Beyond what appears on your feet, certain symptoms should never be ignored. Overwhelming fatigue that's disproportionate to your activity level. You wake up exhausted despite adequate sleep. You have no energy to complete normal daily tasks. This could indicate your liver is struggling. Mental confusion or excessive drowsiness. Brain fog that makes concentration difficult. Personality changes that seem out of character. These symptoms may indicate hepatic encephalopathy, a serious condition caused by toxin accumulation in the brain when the liver cannot filter blood properly. This requires immediate medical intervention, persistent nausea, and complete loss of appetite. Constant queasiness. Food holds no appeal whatsoever. This can stem from compromised liver function. Dark urine resembling the color of cola or tea, combined with very pale, clay-colored or grayish stools. This specific combination signals that bile is not flowing correctly. It's leaking into your bloodstream instead of reaching your intestines. This is a red alert symptom. Jaundice, which is yellowing of the whites of your eyes and skin. This is perhaps the most recognized liver symptom. If you or someone else notices yellow discoloration in your eyes, seek medical care promptly. While jaundice can have multiple causes, including pancreatic issues, it often indicates significant liver dysfunction. If you have 2 or more of these symptoms, especially if they're rapidly evolving, don't delay. Call your doctor. Visit an urgent care center. Go to an emergency room if symptoms are severe. Time matters profoundly when it comes to liver health. Protecting your liver starting today. Knowledge without action accomplishes nothing. So let's talk about what you can actually do right now to protect this vital organ. Alcohol consumption requires serious consideration. Research demonstrates that alcohol provides no cardiovascular protective benefits and increases risk for multiple cancer types. If you drink heavily, reduction is critical. If you already have liver disease, complete abstinence may be medically necessary. Discuss this honestly with your physician. Weight management matters tremendously. Non-alcoholic fatty liver disease has become one of the leading global health concerns. More than 30% of American adults have some degree of liver fat accumulation. Regular physical activity helps reverse this. Walk 30 minutes daily. Incorporate strength training twice weekly. Exercise directly protects liver tissue. Nutrition forms the foundation of liver health. Adopt a Mediterranean-style eating pattern. Emphasize vegetables, fruits, legumes, and whole grains. Use olive oil as your primary fat source. Include omega-3 rich fish like salmon, mackerel, and sardines. Recent research shows even zero-calorie sodas may increase liver fat. Minimize ultra-processed foods. Reduce added sugar consumption. Your liver will thank you. Medication awareness prevents accidental harm. Even common over-the-counter drugs can stress your liver. Acetaminophen, found in Tylenol and many cold remedies, can damage the liver in high doses or with prolonged use. Non-steroidal anti-inflammatory drugs like ibuprofen and naproxen also pose risks. Always follow dosing instructions carefully. If you have existing liver disease, some medications require dose adjustments. Never assume a drug is safe just because you don't need a prescription. Consult your pharmacist or doctor about any medication you take regularly. Vaccination provides crucial protection. Verify your hepatitis A and hepatitis B vaccination status. Both vaccines are readily available. In the United States, they're often provided at no cost through public health programs. These vaccines prevent potentially devastating liver infections. Screening and early detection save lives. If you have risk factors, discuss appropriate testing with your healthcare provider. Risk factors include obesity, type 2 diabetes, family history of liver disease, or being over 40 years old. Basic screening involves blood tests. Liver enzyme tests include ALT, AST, and GGT. Bilirubin and albumin levels provide additional information. Imaging studies like liver ultrasound can detect fatty infiltration. In some cases, specialized tests like elastography measure liver stiffness and fibrosis. These tests are non-invasive and remarkably informative. The science behind liver disease progression. Understanding how liver damage actually develops helps explain why these foot symptoms matter so profoundly. Your liver possesses remarkable regenerative capacity. Unlike most organs, it can actually grow back. If you removed 60% of a healthy liver, it would regenerate to its full size within months. This is extraordinary. But this remarkable ability has limits. When injury occurs repeatedly, when inflammation becomes chronic, when toxins accumulate continuously, the liver's healing mechanism gets overwhelmed. Instead of regenerating healthy tissue, it forms scar tissue. This process is called fibrosis. Think of it like a wound that heals with a thick scar instead of smooth skin. Initially, small amounts of scarring don't significantly impair function. The liver has tremendous reserve capacity. It can lose substantial function before symptoms appear. This is why liver disease is often called a silent killer. You feel fine while damage accumulates. But eventually, the tipping point arrives. When scarring becomes extensive enough, it progresses to cirrhosis. Cirrhosis represents irreversible architectural distortion of liver tissue. The normal organized structure becomes chaotic. Blood flow through the liver becomes impeded. This creates portal hypertension, elevated pressure in the portal vein system. That increased pressure forces fluid out of blood vessels. It causes the ankle and foot swelling we discussed. It creates the spider angiomas through altered blood flow patterns. The compromised liver can no longer perform its 500+ functions adequately. Protein production drops, explaining the low albumin that contributes to Terry's nails and edema. Toxin filtration fails, leading to mental changes and itching. Hormone metabolism becomes impaired, causing the estrogen accumulation behind spider angiomas. This cascade of dysfunction explains why multiple symptoms often appear together. They're not separate random problems. They're interconnected manifestations of declining liver function. What this all means for you right now. Your body communicates constantly. Every symptom carries meaning. Every change tells a story. The question is whether you're listening. Your feet, those parts of your body you probably take for granted most of the time, might be sending urgent messages. They might be showing you something critically important, something that could literally save your life if you pay attention. This isn't about becoming obsessed with every minor change. It's about awareness. It's about being an informed advocate for your own health. Medical science has given us incredible knowledge about how liver disease manifests. We understand the warning signs. We know what to look for. We have the tools to detect problems early. But none of that matters if people ignore the signals, if they dismiss the symptoms, if they wait until it's too late. Liver disease is often silent in its early stages. By the time obvious symptoms appear, significant damage may already exist. But your body tries to warn you along the way, through subtle changes in your feet, through unusual skin manifestations, through symptoms that seem minor but carry major significance. The power lies in recognition, in taking those signs seriously, in having honest conversations with healthcare providers, in getting appropriate testing when warranted. Early-stage liver disease is often reversible. Fatty liver can improve dramatically with lifestyle changes. Mild to moderate fibrosis may regress with proper treatment. But advanced cirrhosis causes permanent scarring. It fundamentally alters liver architecture. At that point, management focuses on preventing further deterioration and addressing complications. The difference between these outcomes often comes down to timing, to catching problems before they progress beyond the point of return. So examine your feet tonight. Really look at them. Check for swelling. Inspect your nails. Note any unusual skin changes. Document what you find. If you recognize multiple warning signs, schedule a medical appointment. Don't wait for a crisis. Don't convince yourself it's probably nothing. Your intuition exists for a reason. Your body's signals deserve respect and investigation. Remember that most people with these symptoms won't have liver disease. Many other conditions cause similar manifestations. But the only way to know for certain is through proper medical evaluation. Blood tests provide objective data. Imaging studies reveal structural changes. These tools remove the guesswork. They provide answers. They guide appropriate treatment. Share this information with people you care about, your family members, your friends, your colleagues. Someone in your circle might be experiencing these exact symptoms right now. They might be confused, worried, or dismissing them. You could provide the knowledge that prompts them to seek help. You could be the reason they catch something early. You could literally save a life simply by sharing what you've learned. Health literacy empowers us all. When we understand how our bodies work, we make better decisions. When we recognize warning signs, we act more quickly. When we advocate for ourselves, we receive better care. Your liver performs over 500 essential functions every single day. It filters toxins from your blood. It produces bile for digestion. It stores energy. It synthesizes crucial proteins. It regulates blood clotting. It metabolizes medications. It breaks down hormones. It supports your immune system. You cannot live without a functioning liver, not even for a few days. This organ deserves your attention and protection. It deserves respect for the incredible work it performs continuously, and when it starts struggling, it deserves prompt, appropriate medical care. Don't let fear prevent you from seeking answers. Yes, liver disease sounds frightening, but knowing is always better than remaining ignorant. Diagnosis opens doors to treatment. It creates opportunities for intervention. It allows you to take control rather than remaining a passive victim. Modern medicine offers remarkable options for liver disease management. Antiviral medications can cure certain types of hepatitis. Lifestyle modifications reverse fatty liver disease. Various medications manage symptoms and slow progression. But all of these options require one critical first step: recognition that a problem exists. That's where you come in. That's your responsibility to yourself. Pay attention to your body. Trust what it's telling you. Investigate changes that concern you. Advocate for comprehensive evaluation when needed. Your health is your most valuable asset. Without it, nothing else truly matters. No achievement feels fulfilling when you're sick. No relationship brings joy when you're suffering. No financial success provides comfort when your body fails. Prioritize your well-being. Make it non-negotiable. Give it the time and attention it deserves. Start today by conducting a thorough self-examination. Look at your feet with fresh eyes. Consider whether any of these warning signs apply to you. If they do, take the next step. Call your doctor's office. Schedule an appointment. Be specific about your concerns. Request appropriate testing. Follow through on recommendations. This simple act of self-advocacy could change the entire trajectory of your health. It could mean the difference between reversible damage and permanent disability. It could mean the difference between managing a condition and facing organ failure. Your feet are talking. The question is whether you're listening. The answer to that question matters more than you might realize. Because sometimes the smallest signs point to the biggest problems. And sometimes paying attention to what seems insignificant becomes the most significant thing you'll ever do. Your liver is counting on you. Your future self is counting on you. Your loved ones are counting on you. Don't let them down. Look at your feet. Listen to your body. Seek answers. Take action. Your health journey begins with a single step. Make sure it's in the right direction. Because every moment you delay is a moment your liver continues working without the support it desperately needs. Act now. Your body is waiting. Your future depends on decisions you make today.